the Health Secretary, Matt Hancock, joins us. Good morning to you.
Good morning. How are you?
Very good, thank you. Why now have you decided to bring in this payment?
Well, one of the pieces of feedback that we've got, especially from areas of low income, is that in order to support people to self-isolate when they need to, then we need to put in more financial support. And obviously, we want to get as many people who have to self-isolate because they've tested positive or because they are a contact of somebody who's tested positive, a close contact. We want to obviously have as high a proportion self-isolating as possible, and the goal is to get to 80%. We're in the 70s, but one of the pieces of feedback is especially people on low incomes need that extra support.
Is this enough money for that? Because £13 a day, I know it's on top of other benefits, is still
Yes.
not an awful lot to live on.
Yes, it's on top of other benefits. It's the rate of statutory sick pay. That's why we've set it at this rate. But of course, each of these people who has tested positive, all their contacts, we get in contact with. We have a phone call with. So this is one of the pieces of feedback from the system itself, and we'll obviously monitor it and see how well this works. And this is one of the reasons we're starting it in Oldham and Blackburn and Pendle. They're the three areas of the country with the highest rates that are in the highest level of local lockdown. And we're working very closely with the local authorities as well, who of course have the boots on the ground, the people who can go and knock on the doors if we can't get hold of somebody by phone. And so yes, we'll monitor that and then see what we need to do in terms of rolling it out further.
Might you need to go further in terms of the money you spend? I mean, Labour Mayor Andy Burnham, Steve Rotherham from Liverpool, Andy Burnham's from Manchester, they said all workers should get their normal wage when asked to isolate at home. So not people on universal credit. Anyone who's asked to work, to stay at home, should get their normal wage paid for by the government. Is there any chance you might go that far?
Well, this is the first step in paying people to self-isolate. We'll monitor how effective it is. I don't rule anything out, but we want to get the system working and we want to see how effective it is. You know, we have a system of statutory sick pay in this country, which is at a flat rate. There's good reasons to do it at a flat rate. It's much, much simpler for starters, and we need to get these payments to people fast, because if you're told to self-isolate, you've got to go straight home, and so we need to get the money to people fast. And also, it's fairer on the taxpayer if it's just a simple flat payment. So we've got to make sure that the system is implemented effectively. To do that, we've got to have it totally integrated with the local council, and we'll see how effective that is in getting that target rate above the 80% that the scientists say that we need to hit for the system to be fully effective.
And how confident can you be that people are self-isolating when they say they are? You're asking them to do 14 days at home, not going out at all,
Yeah.
Not even going shopping. Just human nature would suggest to me that by day 8, 9, if people aren't feeling unwell, if they've shown if they don't feel like they've got coronavirus, do you honestly believe they're going to stay at home? It doesn't seem that likely to me.
Well, we do monitor this, and people are by and large following the instructions, especially under test and trace. Where, remember, if you've had a positive test, then you are ill. You have the virus. If you are a close contact of somebody who's had a positive test, then you'll have direct contact with NHS test and trace, somebody from the NHS system telling you that you need to self-isolate, and so that's just to give a sense of the scale. That has now reached 300,000 people who've been told to self-isolate in that way. We do monitor it. By and large, we think the majority of people are following these instructions, but obviously then we keep that under review as well, including how we enforce it. But it is we've done it without making it a legal requirement as yet, but we don't rule out making those sorts of changes if we need to.
We've been talking this morning about accountability in government. Your government's lost 5 permanent secretaries in the last 6 months. I wonder if that's a deliberate policy because you're at war with the civil service, or it's just a function of the two sides of government not getting on. Why do you think that's happened?
I don't know. I mean, the team that I have been working unbelievably hard and very, very closely. And we've been working 24/7 and very late nights and early mornings right across the board. And really hand in glove with the civil service, who've been doing an absolutely brilliant job.
Is that not true in other
That's
departments then?
I'm the Secretary of State for Health and Social Care, and I'm responsible for how my department operates. And I work very, very closely with my permanent secretary and the whole civil service in my department. I'm incredibly grateful for their public service, for how they've gone out of their way during this pandemic to make things happen at an incredible pace, working all the hours that there are. And I'm just really very, very grateful to their hard work. They are literally serving the nation in its hour of need in the same way as everybody in the NHS has really stepped up in this crisis.
But the Prime Minister didn't feel that was going on in the Department of Education because he stepped in personally and extraordinarily, really, to say goodbye to Jonathan Slater, the Permanent Secretary there.
He's got to make sure that the whole of government is functioning as effectively as possible. What I can tell you is that the civil service who I work with have stepped up and are doing a remarkable job.
Just finally on this point, if you just look at the exam situation, three people arguably in the public mind are responsible for it. You have the head of the Department of Education, the head of Ofqual, and the Secretary of State for Education, Gavin Williamson. And it's not difficult to spot the difference between what's happened to all three of those people there.
Well, look, the total focus in terms of education is on getting schools back. Schools are starting to go back this week, and then the vast majority next week. And getting schools back is so important for children's education, and frankly, for their mental health, also for parents, and to be able to get back to work, because that's so much easier when schools are back. So we've got the total focus at the moment is on getting the schools back. That is going well. Schools have done an incredible amount of planning, and I think you can. I was listening to my Welsh opposite number, Labour Party health minister in Wales. Really, he was out and about earlier this morning. I was listening to him talking about how in Wales they're working so hard to get the schools back. This isn't a party political thing. This is in the interests of the children of the nation, and I'm glad to say that it looks like that process, which is so important, is going ahead pretty effectively.
Matt Hancock, I'm quite interested to ask you about capacity in your office, because obviously there is a desire to get people, to get some people back into the office. I know they're working, but they're not. A lot of them are not in the office. There's a headline in the Times: biggest cities deserted as only 17% of staff return to the office. And then if you look at it by kind of city by city, for example. Newport 42%, Mansfield 43%, Oxford 12%, London 13%. What is the percentage in your department? Do you know, and what would you like it to be?
I have absolutely no idea. What I care about is how effectively people work, and obviously people should come back to the office if that is what they need to do their job. And also obviously employers need to make sure the offices are COVID secure, as we have obviously in the Department for Health, as you would fully expect us to. But what I care about is that people perform. And so the people I work with, some of them have been working from home, some come in sometimes, some are in full time. And what matters to me is that they deliver, and frankly, they've been delivering at an unbelievable rate. I mean, there's sometimes this caricature that the people who work in the civil service work a 9 to 5 day. It's just completely untrue in my experience, and people are working incredibly hard because ultimately it's a mission-driven job, and in the middle of a pandemic, the whole department has stepped up to that mission. It's a moment when we've really need to drive things forward.
Well, it's nice to hear that you're so flexible about it. I suppose the only difficulty here is that Boris Johnson has been very, very strong on this. He said that he wants people, where they can, to get back to the office. So, I mean, is that something you disagree on?
No, I think exactly as you put it, where you can, and I think that this has got to be done, across the board. If you think about the nation as a whole, it's got to be done a COVID secure way. But employers are doing that, and the rules are clear about that. And we've said that we've reverted the rules for the employment rules back to the normal position.
So
And
you
I've
could
seen that the CBI in the last yesterday put out a statement saying that people need to get back to the office, and I've been talking to the chief of the CBI about what more we can do, in addition to saying that the rules are that this is a matter for employers, so long as the place of employment is COVID secure, and of course we'll work with the CBI on the things that they want to see to help make this happen.
I guess you could start by, though, making sure it's happening in your own office. That's the point that's being made here. That if not all people working for the government are going back to the office when they can, which is, as you said, is the government policy, then why should anybody else?
Well, that of course the exact rules about who does and who works where is a matter for the civil service. And but what I just answered the direct question, which is, how many in my department, and the truth is, what I care about as Secretary of State is how well the department performs.
Yeah, I understand the point. Thank you very much, Matt Hancock. He's the Health Secretary